And welcome, everyone. I'm Elizabeth Schwartz. I am the co-chair of the board of SAGE, the nation's oldest and largest organization dedicated to improving the lives of our LGBT elders. I'm also a native, lifelong South Floridian, so I'm especially proud and excited to share with you some of the work that this remarkable organization does right here in my home base. I want to thank all the people who made this evening happen, as anyone who has produced or even participated in a virtual meeting, which at this point is probably everyone, knows this is no small feat. Special shout out for the heavy lift to SAGE's Director of Development, Miami's own Jerry Chasen, the wind beneath my wings. And I thank you for taking time out of your busy schedule to be with us this evening, despite any Zoom fatigue. We really appreciate you joining us. If you tuned in a few minutes early, and I hope you did, you enjoyed a walk down memory lane provided by the photos from some of our events over the past years. And as we also let you know in between those photos, if at any point you have a question or comment, please add them in the live chat wherever it is on your device. Running through tonight's program real quick, I just want to let you know that you are going to hear two recurrent themes. The first is one of partnership. SAGE works with peer organizations to ensure that our community's elders are included, respected, served, and that the needs specific to our community are addressed. To be clear, the partners we elevate tonight are but a fraction of those with whom we play well. Local partners include SAVE, the Pride Center, Pride Lines, and Lambda Living, to name but a few. I also want to give a special shout out to Equality Florida, because our very close partnership with them makes sure that our local electeds are aware of the needs and concerns of our entire community, including our elders. As you'll see later on, we hope many of you will support us in that work. The second theme you'll see running through tonight is COVID-19, SAGE's response to it, the ways the pandemic have affected existing programs, and the ways it will shape the way SAGE's programs and services change going forward. And even in this pandemic, our advocacy efforts resulted in the passage of an LGBT-friendly Older Americans Act, which is the only LGBT-inclusive bipartisan piece of legislation enacted during the previous administration. Tonight's program will be divided into three parts. We'll first talk about the replication in South Florida of SAGE's amazing Friendly Visitors program, an effort made possible in large measure by the generous support of our fund. And we'll then look at SAGE's partnership with Seasons Hospice and Palliative Care, which is a SAGE Care credentialed organization that has also been an amazing partner in our advocacy efforts here in Florida. In part three, we'll be joined by SAGE's CEO, Michael Adams, for a conversation about what's on SAGE's horizons and get his response to some questions that you may have put in the chat, wherever your chat box is. So enough about all that. Let's turn to the first part of our evening, which focuses on the replication of SAGE's Friendly Visitor program at the South Florida Institute on Aging, SOFIA, which is in Wilton Manors. So here to share about that program is SAGE's own Bill Gross, who supervises the program. Bill will be joined by Rachel Foblas, who is SOFIA's Director of Marketing and Community Relations. So take it away, Bill and Rachel. Oh, it seems like you're muted. Unmute yourself. Let us hear the full breadth of all you have to say. I know, it ain't easy.
Am I good? Am I good now? Okay. I'm really excited to be here to talk about our Friendly Visitor program in South Florida. My name is Bill Gross. As Liz said, I have run our Friendly Visitor program in New York for the past 6 years, and I was responsible for bringing the program model down to South Florida and working with SOFIA. In just a moment, Rachel Fablas will join me and we'll talk about the collaboration. But before I do, I just wanted, for those of you who don't know what a Friendly Visitor program is, I'll give you a little bit of a primer. When SAGE was founded in 1978, Friendly Visiting was the first program that was put into place. And the program model over the last 43 years has really stayed pretty much exactly the same. We take a volunteer matched with an LGBT older adult for ongoing social support. Many of the clients of our friendly visitor programs in New York and South Florida don't have much of a social circle anymore for various reasons. In fact, in some of the most stark cases, the friendly visitor volunteer is actually the only non-professional friend in their life. So this ongoing social support takes the place in non-COVID times in weekly visits. Volunteers might play cards, go out for coffee, take a walk, do some errands. You may or may not be surprised at how many volunteers end up singing show tunes with their friends at home, as we call them. But the common theme is the impact these weekly visits can have on a client. We're going to talk about COVID with Rachel in just a second. But as introduction to Sophia, we've been thinking at some point that it would be good to partner with an outside organization to bring this great program to another area of the country. Several of our affiliates across the country do have friendly visitor programs, but our collaboration with Sophia was the first time that we actually partnered with an outside agency. And there were 3 reasons why this was a good fit. First, we knew that Fort Lauderdale had a large number of LGBT older adults. We had connections down there already. We have an affiliate in Fort Lauderdale. We have several board members who did an amazing amount of heavy lifting in connection. And lastly, with the South Florida Institute on Aging, we found an agency that had decades worth of a track record of client-based social support services that involved volunteers. So it was kind of the perfect fit. While Sophia, until we came, didn't have LGBT programming, when we arrived, we were able to serve that population using the resources that were already in place. So that being said, I'd like to use that opportunity to introduce Rachel Fablas to the screen with me to have a little conversation about our work over the past year and a half. Hello, Rachel.
Hi. Hi, Bill. How are you?
Well, your mic is working. That's not fair.
I'm kind of a pro at this since we've been doing this for a year.
Yes, you're kind of using your radio voice. So anyway, they're going to tell us we're using too much time. So Rachel, tell us, I was talking a little bit about why Sophia was a great fit for us. Why did you think this kind of program might really work in South Florida, and why Sage?
Well, first of all, thank you so much for having me, and I'm excited to be here. Well, for us to pair with Sage and to partner with Sage was an obvious choice. Liz mentioned that in her introduction of your decades-long experience of really advocacy and supporting LGBT older adults. And for us at the South Florida Institute on Aging, SOFIA as our acronym, we really are focused on our seniors and their families and the communities that they live in. So it was just a great fit. And we are really thankful and grateful for that partnership, for this partnership, because it's still going.
It really is. It really was a great fit all around. I know that our first year, a lot of the work had to do with outreach. And since I'm sure a fair amount of the people who are on this call right now, maybe from South Florida, where were some of the places that Sophia looked for potential clients?
We didn't have to look far because we're very, very thankful for the partnerships that we already have. One in particular has to be the Broward County Elderly Veteran Services, which has been around for a long time and really is the go-to for all of our senior services. They are awesome from top to bottom. They're case managers and social workers. Really, we have a real great personal internal communication about what we have available, what's going on, their clients and resources. So they refer us those clients on a consistent basis. And we also are thankful for our resource and outreach with Broward House, who just recently came on board and referring clients from their organization, and also from Humana and Aetna, United Healthcare. We are thankful for those 3 great and big medical insurance providers who have caseworkers on their cases and clients on a consistent basis.
And it strikes me, one of my favorite stories that I heard in terms of outreach seems to happen kind of all over the place. And there was a story very early on of one of the Sophia staff that was in a cafe in Wilton Manors and saw a gentleman, an older adult gentleman at a table quietly crying to himself.
Mm-hmm.
And the Sophia staff member went over and talked to him. And the gentleman had fairly recently lost a long-term partner. And I swear, within 2 days, you had him, he was registered to become a client. He was matched with a volunteer who not only was a great fit, but came from the same neighborhood in Boston that this person had come from. And it was kind of a match made in heaven, kismet.
It actually was a match made in heaven, right? Those are things that you hear in movies. But I really think that's just a great test to our staff. And, anywhere and anything that we're doing, if we see something, we want to help. And I don't want to toot our own horn, but I think that our Sophia staff really have a caring heart. We really care about overall. And that's also another thing that we really admire and love about Sage, is that we really do care. And that Sophia staff member saw something and just went in and it fit. So we're very thankful and glad that worked out.
Yeah, for sure. I'm wondering, I talked about what visits looked like pre-COVID. I'm wondering if you could talk about the shift that happened about a year ago today, almost, in the program.
Yes. So it was a test, I'd say the least, because everything happened really quickly. We officially went remote on March 16th. So we are approaching that 1 year mark for us. And we knew how difficult it was going to be for our seniors, especially for our LGBT older adults, because, like you mentioned, our friendly visitors are their only person sometimes that they have in their life that they can talk to. And having that personal connection is so important. And that was a difficult thing. But we were able to transition all of our friendly visitors and our friends at home to do weekly telephone check-ins, and then also provide resources, because a lot of them couldn't go out, they couldn't get groceries or anything like that. Our friendly visitors do a really great job of being that middleman for us and really communicating with us and also helping as much as they can.
That's great. That it really is true. And talking about those success stories, I'd love to just close. Well, first I'll ask if people are interested in becoming either a client or a volunteer of the Friendly Visitor Program, what should they do, Rachel?
Yes, they should reach out to our great program manager, Todd Dupel, at tdupel@thesophia.org. You can also give us a call at 954-484-7117, extension 123. So that's how you can reach out to us. We are open arms. Our doors are open, not for you to enter, but virtually. And as many friendly visitors that we can get to help with our clients.
And I would say in closing that I know that we're really excited at some point in the future when we're able to go back to in-person visiting. I know our volunteers and our friends at home are interested in that as well. And but boy, what an amazing job to just shift this program over to telephone support within basically a matter of days. So
absolutely.
Thank you so much, Rachel, for joining us.
Thank you, Bill. And we do serve Miami-Dade County. So that was one thing else, guys. Thank you so
much. Liz, back to you.
Thank you. Thank you, Bill and Rachel. And you're so awesome that you saw that Miami question. So thanks for answering that, Rachel. It seems pretty clear that the impact of South Florida's Friendly Visitor Program makes a huge, huge, huge impact in the lives of its participants, both the friendly visitors and the friends at home. People go from being strangers to family in a short time. But not all of our elders have the means or even the well-being to age in place. Many are in need of professional care in a setting that provides the respect and dignity that their pioneering journeys deserve. Sometimes providing that is a matter of educating an agency. Sometimes it's a matter of pressing for changes in the law. Sage does both. We often say that Sage is the aging voice in the LGBT community and the LGBT voice in the aging community. And the next segment illustrates this beautifully. Here to discuss SAGE's engagement with Seasons Hospice and Palliative Care are Lynn Faria, SAGE's Executive Vice President, joined by Russell Hilliard, who's Seasons Senior VP of Key Initiatives and Strategic Partnerships, along with Mark Ritchie, LCSW, Seasons Director of Patient Experience. Take it away, Lynn. We are muted again. Stop muting ourselves. Let us spread our voices out into the universe. Try it again, Lynn. Can we hear you? No, we cannot hear you yet. You've got this. You've got this. Lift your voice. It must not be you. It's them. It's a conspiracy. You're being silenced. What's that about? All right. We're going to have to interrogate that. Worked before. I don't know. Everyone can see and hear me. Lynn, Liz, Lynn. Maybe they just confused us. It would not be the first time. Those interchangeable lesbians. Remove the headphones. Oh my goodness. All right. You know what we might do? We're going to just throw on a video and we're going to come right back to Lynn unless we can hear her right now. No? Okay. We're just going to go to the video. So pivoting like we do in a pandemic. Rock it out.
Community. Hospice is a very intimate time of life. The patient's family members are part of our circle of care. That might be biological family, but they're also called the lavender family, which is our chosen family. You'll find in the LGBT community there's a higher rate of advanced directives, for example, because people have said, I'm clear about what I want and who I want around me at that time of my life. So it's a very complex community with a lot of complex needs, and SAGE does an excellent job of teaching our leadership how to support our staff and providing the education to both levels, the leaders and the staff, in serving the community. That's what good education does, is it teaches us how to meet the patient and the family where they are and whatever that means for them, and ask really informed and respectful questions that show that our heart is there. We want to provide the best care for you, and our heart is open to take that guidance.
Really appreciated the fact that they want inclusion here at Seasons. SAGE was really great for allowing us to learn new ways on communication and bring up different topics, loved ones, partners, and the ideas of death and religion with LGBTQ community members.
SAGE has done a wonderful job of helping prepare all of our staff so they feel confident in their competence for serving the LGBT community. So we're really excited to be platinum partners with SAGE.
Let's try this one more time. Hi everyone, my name is Lynn Faria and I'm SAGE's Executive Vice President. And what you just saw was a testimonial from one of the two guests joining me here tonight from Seasons Hospice and Palliative Care. Well, who you just saw was Dr. Russell Hilliard. I'm also joined, as Liz mentioned, by Mark Ritchie. First, a little bit about Seasons. Seasons Hospice and Palliative Care is the fourth largest hospice company in the U.S. with 31 sites across 19 states and multiple locations across Florida. Seasons is also a SAGE Care Platinum trained agency. SAGE Care is our program that trains aging providers and staff on LGBT cultural competence. It ensures that our LGBT elders and all of us can receive affirming and respectful care, the kind of LGBT competent care that we deserve, that we all deserve. Through SAGE Care, elder care providers earn a bronze, gold, silver, or platinum credential based on the depth and breadth of training that they receive. Seasons has achieved the highest credential level, platinum. And I'd love to talk more with Russell and with Mark, so hopefully we can welcome them to the stream here. Hi, Russell.
Hi, Lynn.
Hi, Mark. Great to see you both. So let's just dive right in. I'd like to talk a bit more about Seasons' journey to becoming SAGE Care trained. Why did Seasons decide to engage with SAGE Care, and did you see a need?
Yeah, Lynn, so thank you so much. You saw in the video the value of it that we experienced, but how we got introduced to Sage was from Robert Boo. He's the CEO of the Pride Center in Wilton Manors, Florida, and he's a founding board of director member at Seasons Hospice of Broward County. And at one of our board meetings, he said, you ought to look into Sage training. I think it would really benefit your staff and volunteers. So we did, and we did the training for both Broward County and Miami-Dade. And I honestly know all of the staff there really well. And I thought, these folks are so loving, so kind, so evolved. They're not homophobic. I'm not sure they need this, Lynn. But what I learned through the process was they really deeply needed it. Our staff gave us amazing feedback. They thanked us for providing the education. They said, oh my goodness, my heart is in the right place, but I was using the wrong words, or I was using the wrong questions in my assessment. And because of this training, I became much more culturally competent. I feel so much more confident in providing care. So we needed it, even though we didn't know we needed it. And then we also had an unfortunate situation in another program in California. We had a hospice aide who I'm sure was well-intended, but she did something very offensive to a gentleman, a gay man, senior, living at home alone, and he had beautiful art on his wall, and it was of the nude male. And she found this offensive, and she actually asked him to remove the art in order for her to visit. And I can't think of a more egregious thing for us to do in healthcare when we're invited into someone's home to provide the most intimate care at the most intimate time of life. This is a complaint of a magnanimous proportion. It just can't happen in hospice care. We have to respect all the homes we go into and all those values that we enter without judgment at all. So obviously there was a need there. We provided that training nationally as a result of that patient complaint, and we haven't had one patient complaint from the LGBT community since that time. So I think it corrected the issue, provided us the baseline that we needed, and also helped us attract a certain workforce that perhaps we weren't attracting before.
That's interesting, Russell. Can you speak a little bit more about that, about how being Sage Care trained does impact your staff, your policies, and your recruitment efforts?
Sure. So from an accountability perspective, we just have a zero tolerance, right? So we've provided the training right during orientation. It's in our policies, non-discrimination. Everything that we do is affirming from a policy perspective. Our documentation language has been changed to be affirming. So it's a culture of affirmation in the LGBT community. So I think folks realize if they have issues with that, probably they don't fit in here. But more importantly, from a recruitment perspective for us, is that in healthcare today, there is a national nursing and social work and CNA shortage, including physician shortage. And so recruitment is one of our biggest challenges as a hospice provider. And so I was delighted when I heard our recruiter say, I didn't realize that Sage, becoming Sage Platinum certified, was one of our greatest recruitment tools. People are attracted to our organization as an employer of choice because we're Sage Platinum certified, and anything that we can do to not only make sure that we're recruiting the right type of staff, but we're also recruiting those with the right heart to serve the LGBT community is really important. But frankly, we just need more nurses too. And Sage is actually helping us do that as well. So it's a win for everybody.
And speaking of win, clearly at the core of what you do are your patients. And Mark, I'm just curious from your perspective, working in patient experience, what has the experience been of your patients since being Sage Care trained?
I think it's been very helpful to a lot of our staff. It also sets the tone. This is part of our orientation for new employees. So anybody that's coming on, this is part of their training. I mean, we have an extensive training package to begin with, and as Russell kind of pointed out, the kind of people that are going to really want to be patient-centered, and that's so important to us here at Seasons, that we honor the individual, regardless of whatever groups they belong to and stuff too. So, and I think, again, it helps us in terms of keeping people involved on that, understanding the culture here is going to be very inclusive, and that's an expectation. So it's been very warmly received here. I think people, again, they have that heart. Sometimes didn't know how to word something, or were afraid to bring it up. It's been a taboo. Miami, we have a large Hispanic population, and it's kind of a taboo topic in many cases, and lots of families are very involved, and it's sort of a not spoken about thing. So how do you mention it? How do you bring it up when you recognize that you're working with somebody who talks about his brother-in-law, and they're sharing an apartment that they've lived together for 20 years? But yeah, and a lot of people, particularly of a certain age, they grew up with a taboo about this, and it's very hard for them to talk about it. And it's also hard, makes it an uncomfortable topic. And again, the training helps our staff knowing how they can bring this up with their patients and their families, and also in facilities. We face going into facilities. A lot of times there's a sexual taboo or no touching allowed in nursing facilities, and sometimes yes, or like visitations. This is not legally a family member necessarily. So again, a lot of help in terms of the advanced directives, knowing this is a gay or lesbian transgender couple. We need to talk to you because the law is not working in your favor unless you're legally married. So if you want visitations, things like that, again, how do I bring this up with people? And that's, it's funny because sex is always the kind of hard one too. Our staff can talk about death, dying, and do not resuscitate funeral plans, but boy, bring up sexuality, and that's a hard one.
Mm-hmm. Mm-hmm. Thanks, Mark. And you actually touched on something really important, right, which is legal protections. And I'm going to pivot a bit away from Sage Care to talk about how Seasons has engaged in advocacy and for pushing for federal non-discrimination protections for LGBT people. You're doing an incredible job, clearly, as we've heard tonight, in serving your patients and in providing a welcoming LGBT competent environment for your patients and for your staff. And you took the next step too, a big step, right? And when our SAGE team reached out to you all to say, would you be interested in joining us in meetings with federal elected officials to advocate for non-discrimination protections, you didn't hesitate. You immediately stepped up and joined SAGE and other LGBT older Floridians in meetings with Senators Rubio and Scott and made that case. And I can't tell you how crucial that is for a business like Seasons to lend your voice to the fight for equality for LGBT people. It is transformative. And it means that electeds aren't just hearing from the usual suspects, LGBT folks and LGBT organizations like SAGE, but also important business stakeholders like you all. So I'm curious, what compelled you all at Seasons to take the step beyond training and become advocates?
Yeah, so Lynn, I think advocacy is a big part of hospice work. Seasons is one of the largest folks who participate in Capitol Hill Day for advocacy for hospice. We're very active in the National Hospice and Palliative Care Organization. So advocacy, lobbying for our patients, for the industry to make sure that folks have access to quality hospice care just goes in our blood. So I believe you actually just called and asked us to advocate and participate. And so when you did, our answer is yes, because it's part of our blood. And when asked, we need to step up. So I'm sorry you had to ask for us to step up, but every time you ask, we're going to step up. It's essential. We have seen through the past few years that there are states and jurisdictions where we're legalizing the discrimination in healthcare against LGBT clients. And this is unacceptable. It's an antithesis to healthcare. It's against the Hippocratic Oath that physicians take. It's against all codes of ethics for nurses and social workers. And it's an outrage. And so it's a pleasure to participate with you all in advocating, and we would do it every chance we get.
And it really makes... Go ahead.
Ditto, just ask. I was delighted to have the opportunity. Again, Russell and I are both also social workers too. So this is very much part of our values in terms of, and our ethical obligation to advocate for disenfranchised populations. And as medical workers too, what we see and we were able to report, I was happy to have that experience, to be able to talk about the experiences as gay people ourselves, as well as what we see of in the healthcare system. And I think it's very important, again, to have people in power and legislative power to know some of the facts. That this isn't just hearsay stuff. This is stuff that's experienced.
And Mark, actually, if I may, you share a story, and you've shared stories in these meetings about your own personal experience, and I hope you feel comfortable sharing with folks tonight, where that really brings it home, right, on the personal level as well as, your work with your patients.
I believe you're referring to is my dad. Interestingly enough, yes, after my mother had died, I was willing to leave. I wanted to actually go up and be closer to my father so I could be a better support to him, realizing this was going to be a very hard time for him. And I interviewed for a job up there and informed him that I was going to move up there. And he told me, no way, that you aren't going to do that, because I know you live in South Beach and South Florida where people are very accepting. And he was really concerned that I was going to be facing discrimination and that people wouldn't treat me so well. It was kind of cute. He probably smacked me upside my head for saying that. But yeah, it was. And this is a man who, by the way, yes, when I found out that I was gay, decided that he wanted no further contact with me too. So, I mean, years later, this is how things developed. And again, just to advocate that it's your family members. This goes back to the Harvey Milk stuff, and where we learned it's like once people find out that it's someone they love is LGBTQ, they can't stop loving you. It doesn't work that way. They might wish they could, and they can try. But yeah, and those again make for very powerful stories. That's how we build so many of our allies, and how we've progressed and come so far, I think.
I couldn't have said it better myself, Mark. I mean, thank you for sharing your story. Thank you for sharing them with electeds, and thank you for sharing it here tonight. Clearly we could talk a lot longer, but we must get on with the program. And so I want to thank you both so much for making the time this evening and for being such leaders and champions for LGBT elders. We could not do this without amazing partners like you. So Liz, I'm going to send it back to you, and thank you all.
Awesome. Thank you, Lynn. Thank you, Mark and Russell. That was a really interesting, amazing conversation. Just highlights so many issues that focus SAGE's work. Right now, I am honored to be joined by Michael Adams. Not only is Michael SAGE's CEO, but he is also the president of the American Society on Aging. The ASA, if you don't know, is the largest, most diverse community of professionals working in aging in America. And it's the premier source to cultivate leadership, advance knowledge, and strengthen the skills of those who work with and on behalf of older adults. Michael's screen is black, so I'm not sure if that's some form of protest on his part, but I'm going to keep talking for a second. Because it is really amazing that SAGE's CEO is the head of the ASA. So, I mean, the ASA is like the biggest deal in aging. And so the fact that our CEO is representing, I look frozen? Uh-oh. Me frozen? Or maybe Michael's frozen. Okay, Michael's frozen. Okay. I'm trying to read the chat and talk to you all. So hopefully Michael is going to show up in a second. And maybe he'll talk about his role on the ASA if we have time, because it's just really important that SAGE Care's mission of creating cultural competence for our LGBT elders is sort of being spread in this, massive way through Michael leading the ASA. So it's something that we're really proud of. And it's something we all should be proud of in our movement, that an organization like this mainstream organization, would want to have an openly gay person who runs an LGBT aging organization. So it's something that should make us all proud in terms of the way in which our community's issues are being elevated, that it's not just a sort of a fringe diversity issue. So really, really very proud of Michael. Oh, here he is. Okay, well, Michael, I just told your ASA story. Sorry about that.
It's okay.
So,
you learn with technology.
Okay, I know. Right? Look at how I'm Michael Adams, CEO of SAGE. We got to move you over. You're lower third. There you go. We're going to roll with it. Have we not learned to pivot in a pandemic? It is what we do. So I will I will say this, that it is pretty clear that life after COVID will not look like it did before. And just as we've had to pivot tonight, the very experience of navigating through the pandemic itself has demanded changes and adaptations and new responses that are going to survive in the aftermath. So Michael, tell us a little bit about how SAGE's programs and services and advocacy look different now, and maybe how they are going to look different in the future.
Sure, absolutely. And we, like many service providers all across the country, were forced to really pivot on a dime, right? Last March, when the pandemic really exploded, and our SAGE centers and our SAGE affiliates across the country that are serving many thousands of LGBT older folks in person every day under normal circumstances, all of a sudden we had to figure out how to do that without being able to be in person. And that contact is so key, because so many older members of our communities are really dealing with very, very serious social isolation, which is hard enough under normal circumstances, obviously even harder in the midst of a scary and sadly deadly pandemic, right? So in a very short period of time, we pivoted our programs to virtual programs, to offering as many of the activities and services and programs as we could online. And actually, I would say that in a way, even the most horrible of things has a silver lining. And I think one of the silver linings as we emerge out of the pandemic is that we're going to be able to continue that virtual programming and keep expanding it and growing it. So that people that may not be able to physically make it into a SAGE program across the country will actually be able to participate. So that was one big change for us. And we've also launched a couple of new programs during the pandemic. We launched a program, for example, called SAGE Connect, and it's really an incredible program that links up elders who are isolated at home with a volunteer. It's essentially the telephone version of the Friendly Visitor program that Bill was talking about earlier with our colleagues from South Florida Institute on Aging. And so we have now more than 500 volunteers all across the country who once or twice a week are calling in and having phone calls with elders in our community. And unfortunately, that sometimes is the only person that elder gets to talk to that week, right? So the SAGE Connect program is really, really important. We also launched an online program called SAGE Sense. I'm recognizing that the pandemic has actually made finances even harder for a lot of older members of our community. And so what SAGE Sense does is it's a website you can go to and kind of interact and put your kind of financial issues in and ask questions and get some resources, get hooked up with a coach actually to help people think through their financial issues and come up with the best plans possible. We have over 700 older folks in our communities across the country participating in SAGE Sense now. So these are some of the ways that we've pivoted. Obviously, we've also pivoted some of our policy advocacy work to ensure that the COVID relief legislation and things like that at every level, at the local, state, and federal level, are focusing on older Americans, which they have to. Older folks have been so hard hit by this pandemic, and by members of our communities as well. So it's been a big pivot in multiple ways. We've had a lot of good progress and challenges, and there are some silver linings too.
Talk a little bit about some of that national policy advocacy work. One of the things that I love so much about SAGE is how we partner with our peer organizations. And so tell us a little bit about how we're doing that in the national advocacy space.
Sure. Well, we're doing that in so many different ways. And one thing I'll mention really quickly is it was referenced earlier that last year, SAGE won the only LGBT victory in Congress during the prior administration, and we did that because of partnership, right? We did that because of partnership, and we had 18 different nonprofit organizations that day on Capitol Hill when we were up there doing our National Advocacy Day come in and lend their staff to SAGE in order to help us bring almost 200 LGBT older folks to Capitol Hill offices all across the Capitol. And the reason they did that is because we partner well with all those organizations, LGBT organizations, aging organizations, and so they want to then partner with us. And this is how it works. We're there for each other. We've worked really closely in Florida with Equality Florida and with numerous other organizations. We've done a lot of great work with Equality Florida, for example, in terms of working to try to gain local support in Florida for the Equality Act in Congress, which is our big LGBT omnibus rights bill that we're hoping to get through Congress this time. At the national level, we're now working really closely with a broad array of organizations, everybody from the Human Rights Campaign to the ACLU to the National Center for Lesbian Rights and so many other organizations to get the Equality Act passed. We are joining together as a coalition, working side by side to get that done in this Congress. While we have a pro-LGBT majority in Congress and a pro-LGBT president in the White House. And so it's all about partnership and collaboration and working together. At SAGE, we've been able to accomplish so much more by working together than we would have been able to accomplish if we had, if we've been trying to do it all on our own.
Love that. And speaking of partnership opportunities and Equality Florida, folks probably know about this new decision from the Florida Council on Human Relations, which affirms that Florida's state laws prohibiting discrimination on the basis of sex in employment and housing and public accommodations also protects LGBTQ people from discrimination in those areas. So how does that decision change the advocacy landscape in Florida, and what are we doing moving forward?
Yeah. First of all, huge victory. So exciting. And we're so happy, proud of all the activists, Equality Florida, and all the other activists in Florida that worked so long and hard to get to that point. And it's transformative. It completely transforms the landscape because it means that LGBT folks all across the state of Florida now have legal protections in employment, in housing, in credit, in public accommodations. I mean, this is really groundbreaking. From SAGE's perspective, what's important is that older folks in our community are aware of those protections, and that when those protections aren't honored, because sadly we know that's the case, we know what discrimination is still occurring against our community, that older folks in our community, along with everybody else, knows how to step up and raise their hand and say, I've been discriminated against, and can seek, and can seek a response, right? And a response and a correction on that in light of these new protections. And I want to say that I think that that's even more important as we emerge from this pandemic, right? One of the things that the pandemic has done, I think, is help our community and society as a whole focus more on our elders, right? Remember that our elder pioneers, the people who started our community, who got our movement going, in many cases are the folks who are experiencing some of the greatest challenges, not only with discrimination, but now from a global pandemic. Our community is getting that more and more and putting our elders front and center where they belong. And similarly in Florida, as we push to ensure that those amazing new legal protections are implemented, we have to make sure that they're implemented energetically on behalf of our elders.
Absolutely. And while we're on the topic, I do not want to miss the opportunity to invite everyone to help us enrich our advocacy work by signing up for Equality Florida's virtual Lobby Day program. There it is right there. You will attend a training and then a virtual meeting with our state lawmakers to share your story about why you advocate for LGBT elders. Sharing your story, whether you're an LGBT elder yourself, a member of the LGBT community, an ally, it's a super effective way to show Florida lawmakers why policies like statewide non-discrimination protections are crucial. So please sign up for Equality Florida's Lobby Day program, and also sign up with SAGE to help us lift up these stories. Adding these stories, as Michael just mentioned, it puts in very personal terms why all of this matters. So as you can see on the screen, please sign up to support our advocacy work by emailing advocacy@sage.org. sageUSA.org. And help us tell these stories. It's really, you'd be surprised how many people are like, what do you mean LGBT elders get discriminated against? You know, the stories that we heard earlier about you can't put a picture up in your assisted living facility, you know, of a guy. It's just crazy. So Michael, speaking of Seasons Hospice and our wonderful partners that we work with who get Sage Care trained and credentialed, what happens if like folks say, you know, I don't want to do the training, you know, it's against my beliefs or it's too political? How do we address that?
Well, I think, Mark from Seasons said something earlier on that really got to the whole point of this, is that the point here is about person-centered care, right? It's about respecting every individual and care for the person they are, the full person they are. We're not asking people to change their religious beliefs, people are entitled to their religious beliefs. What we're asking is that when providing care, right, in a professional setting, that be the focus, what the person that you're caring for needs. And so we do some of that through our advocacy work with companies themselves, right? And try to help the companies train their staff to realize, yes, we're respecting your beliefs. We need you to respect the people you're caring for as well. We also do that through our policy advocacy in a number of states across the country. We've successfully encouraged states to pass laws that mandate that this kind of training go on. As a statement of public policy, again, yes, respect for religious beliefs. At the same time, we have to respect people in need of care. So that's the approach that we try to take in our work, and we're making a lot of progress, which is really great.
Super exciting, including training a bunch of folks down here in South Florida. So that's really great. I talked at the top, well, I don't know if you could hear when your video wasn't working, but I was talking a little bit about how massive it is that you're the head of the ASA and just how meaningful that is, both in the LGBT space and the aging space. So can you speak to the population explosion? I mean, like as the head of the ASA, can you talk a little bit about the population explosion of elder adults in the population generally and in the LGBT community specifically? And like, what do you see as some of the most effective ways of addressing this tremendous growth? What's a silver boom or whatever you call it? So what do you see as some of the most effective ways of addressing that growth for the benefit of the largest numbers of LGBT elders in the coming year? Silver tsunami. Thank you, Jerry.
Yeah. So and it's a great honor to be the chair of the American Society on Aging, and I think it's it means so much that as the head of SAGE, I've been elected to that role. And it is right. We are in an extraordinary population explosion when it comes to older people in this country. Sometimes explosion can mean it has a negative connotation. In this context, I actually think that it's a great thing for our country, right? That we have people living longer and living into their later years, and at the same time, it changes the equation in terms of what we need by way of community support, by what we need by way of public services and public policy. And so what we're seeking for both SAGE and the American Society on Aging and other aging organizations, we're asking for something very simple, which is what we call an age-friendly approach to our lives, right? To recognize in public policy and our community programs that older folks are large numbers of people are growing, that we have to think about everything, whether it's how you design the community, what kind of services and stores and businesses you have in the community, what kind of housing you have in the community. It has to be a community that is welcoming to our growing numbers of older people. And of course, at SAGE, we say it's got to be welcoming to people who are older and people who are LGBT, and in many cases, people are both, right? And so that creates a whole policy agenda. SAGE works in close partnership with not only the American Society on Aging, but with AARP, the National Council on Aging, and many other aging groups to push a very comprehensive aging agenda. It means robust support for the Older Americans Act and things of that nature, and working at the state and local level, importantly, elder community services and things of that nature, they happen at the community level, right? And so as much as our national work is working in partnership with local organizations to make sure that we are kind of taking care of our growing older population on the ground is really key. So it's a big body of work, and we're up for it, and we're doing it.
That's awesome. Thank you. And it's so exciting to sort of think about all of this work that SAGE is doing around LGBT housing, not only SAGE's 2 buildings, but the work that we're doing, training others around the country to create LGBT friendly housing. It's beautiful. I love the statement on our website that I think was just maybe posted, that SAGE is more than just an organization. It's a movement of loving, caring activists dedicated to providing advocacy, services, and support to older members of the LGBT community. LGBT elders fought and still fight for our rights, and we will never stop fighting for theirs. Love that.
Absolutely. That's it. And we refuse to be invisible.
That's right. Oh my gosh. Well, thank you, Michael. It's such an honor to have you heading up our organization, heading up the ASA, partnering with you these last 7 years. So our time is about up. I'd like to thank everyone for having joined us. I'm pretty sure you can see that this is all of the above. You can see why this tremendous organization has been the focus of much of my time and energy and passion for the last 7 years. It pays back the efforts of our elders who have borne the brunt of much of our community's struggle for equality. Those who have fought prejudice and insisted that our lives deserve inclusion and respect. But I also love how it pays forward the legacy that these pioneers leave us. It's a legacy of community, of partnership, and of persistence. Since we're talking about paying, this is, as promised, indeed a free event. But if what you heard or saw touched you, inspired you, or if you saw some way our work is a benefit to you and those you love, then please support the SAGE Strong Resiliency Fund. The fund was created to provide SAGE with resources needed to respond quickly and powerfully to the realities of the world during the COVID-19 pandemic and whatever else the future may bring. So please just go to sageusa.org/SageStrong and give anything you feel like. We are so grateful to all of you who have joined us tonight. We're so grateful to those of you who have contributed generously already. And while we haven't been able to ply you tonight with our annual drinks and hors d'oeuvres that you have had in the past, which usually preceded a pitch like this one, often by Jerry Chasen or myself, we are confident that while you may have come for the cocktails, you always left with a better understanding of why SAGE. And while that event cannot be one that happens tonight, we hope that you understand how SAGE's national effort impacts our local community in very direct ways. And I hope we show you that tonight. We're super honored to have celebrated SAGE's work together with you all. Thank you once more for joining us. Good night.